Good morning, everyone. We will be starting in 3 minutes. We will be starting in 3 minutes. Thanks. Good morning, everyone. Thank you for joining us for Prevention Action Alliance's monthly advocacy webinar this morning. My name is JP Dorval, and I am the Manager of Legislative Affairs and Administrative Services here at Prevention Action Alliance. And with us today, we have Executive Director Marcie Seidel. Today's webinar will focus on the usual topics, updates from the legislature, along with updates from our medical marijuana control program. So let's get started. So just a quick update about our biennial budget. So the Senate and the House Conference Committee failed to pass the budget by July 1st. Now, what does this mean? This means that, so the Senate and the House have a constitutional obligation to pass a 2-year state budget by the 1st of July, which is the start of the new fiscal year. If they fail to do that, they have to find some way to continue to fund the state so that essential function of the state can continue running while they continue deliberations. And that is that 17-day interim budget, which they passed prior to July 1st. So that pretty much buys them time until July 17th to find some common ground to pass this budget. We at Prevention Action Alliance are hopeful that the $36 million in prevention funding that we fought so hard for throughout the month of June will be reinstated in this final version of the budget. We had a lot of great work done by different coalition members, along with work from our staff. And I know we testified a bunch of times on that, and we heard from the minority, which is the Democrats in both the House and the Senate, that they plan to introduce an amendment in conference committee asking for that $36 million to be reinstated in full, and if not in full, asking for that funding to be reinstated with a bit more funding for the K through 12 portion of that $36 million, and a bit less for the stigma reduction campaigns. But regardless, we are confident that that funding will be reinstated in full, or at least partially. So right now, there's not much that we can do. There's not much that can be done on the part of advocacy. We're kind of in a holding pattern. This week, Leader Householder and President Ophoff are meeting along with the chairman of both the House Finance Committee and the Senate Finance Committee. They are all meeting this week to see if they can find some common ground and find a way to pass this budget. So we'll just wait to see, and once the 17th hits, hopefully they have a new budget passed. I did read that Leader Householder does have a plan to pass a second interim budget, another 15 to 17-day interim budget, if negotiations don't go the way he wants them to go during this first 17-day period. So we'll keep an eye on that. Hopefully they find some common ground and pass it, because obviously we have things that need to be funded, and the longer they wait, the more difficult this next fiscal year, or really the more difficult these next 2 fiscal years are going to be. So we're trying to wait and see. Next, I just wanted to give you guys a quick update on Senate Bill 57. Once again, this is the hemp bill, the bill to decriminalize hemp and hemp products, and to establish a hemp cultivation licensing program in the state of Ohio. As you recall, we were doing a lot of work with this a couple months ago, trying to get a cannabis educational awareness campaign through this bill. Unfortunately, the sponsor of the bill, Senator Huffman, was not a fan of that idea. He wanted to separate the hemp bill from the medical marijuana control program, or medical marijuana, as clearly as possible. He wanted to make sure that those were not connected. So for him, he saw this campaign as a way to connect the two, and he was not a fan of that. So unfortunately, we were not able to get that amendment into the budget. We were told earlier in the year that this would be a bill that would pass through the Senate and House very quickly, and would be instituted by the next growing season. As you know, a lot of the farmers in the state of Ohio are suffering, not only because of the rain and the flooding, but also like the tariff battle that has been happening on the federal level. So there are a lot of things causing our farmers to struggle in the state. So this was seen as a way to get them some income and help ameliorate their situation as we deal with the weather issues and such. So we were told, or at least I read, I believe yesterday, that Speaker Householder actually plans to hold this bill in the House until the fall. I'm not quite sure whether it's because of the budget. He kind of wants all hands on deck for that, or if there's another reason. But this bill will not be passed out of the House until the fall. And I do know that that bothers a few of the stakeholders in the state, such as the Ohio State University. I know they were planning to start planting this next growing season. Obviously, farmers and the Wholesale Markets Association and a bunch of other groups that were really hoping to get this program up and running this next year, that kind of throws their schedule off. So they're not too happy about that. But then again, he is the Speaker of the House, so we'll wait to see what happens with that. There is a CBD component to that bill. So CBD products derived from hemp will be allowed to be sold in stores once this bill is passed. So that's just something to keep in mind. And there are stores, both brick and mortar and online pages, that currently sell CBD products in the state legally. We just have an enforcement issue with that. And that is really where the Wholesalers Market Association, I believe that's what they're called, that's where their interest in this bill is, because they don't know what to tell their members. So there are a bunch of different stakeholders in this bill. At this point, we've kind of just put this on the back burner and are keeping a close eye on it. But we are going to pursue this cannabis educational campaign through other means. Next, just wanted to give an update on House Bill 10, which is the Governor's Office of Drug Policy bill. So this bill, as a reminder, creates the Governor's Office of Drug Policy and also makes an appropriation, $5.5 million per year, so $11 million over 2 years for the functioning of this office. It passed the House without any issues. Once again, this is a priority of Speaker Householder, so we knew it was going to pass the House pretty easily. Now the question is, how long will it take to get through the Senate? This is a priority of the House. This is not a priority of the Senate. And given the current climate, it seems like both Larry Householder and Larry Ophoff, the House Speaker and the Senate President, are kind of in a battle right now over a couple of things. So I'm a little worried that this might be caught in the crossfire of that battle and might end up stalling out in the Senate for a bit. But we will see. So this this bill is good for a bunch of reasons. This is an avenue that we could use to implement that cannabis educational awareness campaign that I mentioned earlier, and a bunch of other things, and really would add some cohesiveness to the behavioral health space, especially the prevention space in Ohio. Having that office in the governor's office or at the governor level would be very good for us. So we are pretty involved in that, and we'll keep you guys updated on any developments that occur. The next bill I want to briefly mention is House Bill 12. This bill creates the Ohio Children's Behavioral Health and Prevention Network Stakeholder Group. This bill really is kind of the child of a few children hospitals in the state. They really want to get involved in the behavioral health space and prevention. So this is kind of their way to get their foot in the door to create this group to see if they can have some recommendations as well. We at Prevention Action Alliance are trying to see if we can get an amendment to add that prevention credentialing, or at least a person credentialed in prevention needs to be on there. I'm not too worried that prevention won't be included in this. I think it's pretty obvious that prevention individuals will be included, but we do want to make sure that they have that prevention credentialing. And having that in there would also elevate the prevention field in the state as well. So that's just something that we're trying to get in there. But other than that, it's a pretty good bill. It did pass the House, and it is also a priority bill for Speaker Householder. So the things I mentioned for House Bill 10 kind of also apply to this. Hopefully this doesn't get caught in crossfire, but it might. So we're also waiting to see what happens with that, and we'll keep you guys updated on any developments. With all that being said, I'm going to pass it along to Marcie for your medical marijuana control program updates. Marcie?
Good morning. It's a lovely day here in Columbus, Ohio, and a lovely July. Kind of quiet now after the 4th of July, but marijuana seems to be rolling right along as we look at the Ohio Medical Marijuana Control Program. Not much has changed as far as the growing and the dispensaries in this program. Everything is the same as we reported last month, with only 8 provisional licenses in the level 1 group and 9 in the level 2 group. So slowly we're about halfway there now, a little over halfway there to having everybody up and going. Dispensaries has only increased. One additional one is open since we last talked. And so we're now up to 19 now that have received their certificate of operation. And a lot of people are questioning why this is taking so long and why it's so slow. And the understanding that we are getting from the state level is that the state is up and has everything in place, and all of the people that are going to be inspecting the locations to give them the certificate of operation are ready and willing to go. The problem seems to be, as we're hearing it, is that in the communities now, once these things are actually becoming a reality and not just a concept, they're getting a little bit more nervous in the communities about what this might mean to their community. So they're slowing down and doing more of their due diligence to make sure that everything is covered well, so that all of the regs and the procedures that need to go into those different locales are being followed, and everybody's doing what they need to be doing to make sure that their communities are the way they want their communities to be. The other piece of it that's kind of, if anyone is trying to do an addition or some remodeling on their house, or even to build a new location, you're finding that the builders and the suppliers in the state are very, very busy right now. So that kind of slows things down as well, because all of these are new places that need to be up and moving. And so getting someone to come and do all the work that needs to be done in the construction industry is very slow. So that's why it's taking a great deal of time, but it is moving forward. Okay. There we go. So here's where the figures look like right now from last month. We have plant material. We have 1,487 pounds have been distributed. That's up from the 1,181 from last month. Units of manufactured products have just almost doubled, not quite doubled, but you can see we're up over the 21,000 mark, opposed to the 12,000 mark that we had last month. And product sales, the actual dollar amount, you can see we've gone up to 12.4 million. Last month we had 9.7 million. And then the total receipts are up substantially too, as you can see there. So the products are moving out the door, and the industry is growing, even though we don't have everything available yet. We have here the numbers of the individuals, the patients, and the caregivers. Actually, I take that back. I didn't update the number there at 5/31. That's actually from June 30th. And you can see here that we have 42,372 recommendations that have been made. That is up substantially from last month. Registered patients are up by about 4,000 from last month. And when you're thinking about why is there a difference between registered patients and recommendations, and the answer to that will be is that registered patients sometimes get more than one recommendation. So they may have it for cancer, then they may have it for pain, or they may have it for fibromyalgia or any number of things, but they'll get a different one for each one of those things. Veteran status has increased slightly, just a little under 300 individuals in the patients in the veteran status, and about a little over 200 patients in the indigent status have increased since last month. And then we can see that the terminal diagnosis has gone up, but as I pointed out previously, of all the different 42,000 individual recommendations, only 385 of them are in what we would continue the last term of their life, which is quite different than what this program was sold in the very beginning, as it started a number of years ago. And then our registered caretakers proportionally have increased in the last month by a little over 1,000. Physicians, too, they continue to look at physicians each month at the medical board, and we're up to 512 now. They have certificates to recommend, and again, to remember that that's the CTR initials that will be behind the MD or the OD on their names. These individuals have the ability to then recommend marijuana, but keep in mind that they only recommend it. They do not recommend the dosage. They don't recommend the type of marijuana that one uses. They just recommended that their patient qualifies, in their opinion, to use marijuana. Okay, last month we talked about we were just about ready to go we were the day before going into the state medical board meeting where they were going to look at adding qualifying conditions. At that meeting, they were looking at 5. And the 5 are there on the screen: autism, anxiety, depression, insomnia, and the opiate use disorder. They voted down in that meeting the depression, insomnia, and opiate use disorder because they believed there was not enough information or studies or literature that would support having that as a qualifying condition. They are still continuing to look at autism spectrum disorder and anxiety. And the only reason they did not even discuss it at the meeting or decided not to take a vote on it was because they have a change in the board directors at this point. And there's some that are cycling off and some new ones that are coming on. And the new ones have not yet had an opportunity, in their opinion, to get involved in looking and studying the ability of these two conditions being added to the qualifying conditions. So they wanted to give them enough time to be able to do that before they voted on it and discussed it. At this point, I have not heard when they will come to the meeting with this consideration for discussion and for a vote. We'll keep tabs on it to make sure that we're on top of it. Not exactly sure that any of us here at Prevention Action Alliance feel that either one of those are a good qualifying condition, and think there's a lot of literature that could be just the opposite of what people have turned in. So if you have an opinion about any of those, I encourage you to to send it or contact the state medical board and let them know your opinion as well.
So at this point in time, we will move on to the questions portion of our webinar. We do know that it's a bit short, but then again, the state's kind of in a holding pattern, so there isn't much to report on. So if you guys have any questions for Marcie or me, we will be here for the next couple of minutes, but we're probably going to end the webinar a bit early today. I did read, Marcie, that there is a mother, I believe, who's kind of heading the effort when it comes to the autism spectrum disorder piece of the qualifying conditions. And she claims that she read that apparently THC is to some degree naturally occurring in the brain, and that some autism, some cases of autism within that spectrum are caused by, or at least have, are related to a low natural THC rate. So she claimed that increasing the THC intake for her child would help her child's autism, disorder. So that's just something that I read. Then again, as you said, there really isn't any or little to no, there is little to no literature or research to back that up. I don't know where she gets that from, but that's just something I believe I read in the Columbus Dispatch or something like that. So that's just like an interesting tidbit. But the conversation about marijuana is definitely at the forefront now for prevention. And that's just something that I think everyone should really keep an eye on in the next couple of months as we talk about medical marijuana, we talk about recreational, we talk about decriminalization of marijuana. This is just something that's going to be really at the forefront of all of our conversations this coming year. So just something to note. So we do have one question, and that is, as we continue to watch the medical marijuana process roll out, what are your recommendations, Marcie, for what coalitions can continue to do?
Yeah, thanks. That's a wonderful question. We're looking here, still working to do something that we're hoping that we can find some support to do it, and that's sort of a statewide campaign to be a depository for solid information. There's so much misinformation out about marijuana, and that's easily understood by an industry that's trying to get a huge foothold into a marketplace. And so they're going to put out all the things that they think are going to draw people in and kind of skew things and spin things that aren't exactly true. And we believe that we need to have a lot of good information out there with people. And so while we're working here at the state level to figure out what we can do to support you in the communities and get you information and things that can happen, we encourage you to go ahead and start educating your community about really what marijuana is, and the lack of the research that's being done right now. That certainly anybody can do research and come up with a study that can be skewed to the way they want it to be, and there's a lot of those studies out there now. So people need to understand to be very discerning about where they're getting their information from and who's sponsoring that information and if it's really true. On the other hand, we are here at Prevention Action Alliance, and we encourage all of you out there to go out into your community and create forums and get valuable information out to people. I have been speaking in a number of locations with people that are many times are in our field or in our related field, and it's amazing that there are certain things that people don't know. For example, there's a lot of people that believe medical marijuana does not have THC in it, that it won't get anybody high, will cause no psychoactive things happening in their brain, and that's totally not it when you can have as much as a high of 35% THC, which is psychotic producing, in a brain, can be. So there is anywhere from a small amount of THC to a great deal of THC, and in most cases, it's a great deal of THC in medical marijuana. A lot of people don't know that. Even legislators don't know that. Another thing is that I talked to some individuals at a meeting a couple of weeks ago, and again, it was health professionals, and they did not know that it wasn't a prescription. They thought that you could just go in and you could get it just like any other drug. In fact, that it is a recommendation, and it's so much different than a prescription. Those are the kinds of things that people really don't know. People don't know the difference between marijuana, medical marijuana, hemp, marijuana that has been FDA approved, as in Epidiolex, and Marinol. So there's a lot of misconception out there. So anything that you can do to start to educate your community about what this is really about, and we encourage to go with facts. Just absolutely no scare tactics, no trying to put the spin on things. Give them the facts, because the facts can speak for themselves. And we will here at Prevention Action Alliance start putting together tools for you that will make it a little bit easier. But in the meantime, let's get the facts out there and start that spiff process about what does your community believe. If you can start to do some assessments in your community to find out what the belief system is in your community and where it is that you need to give them the information that they need so that they have the good, solid reality of this drug. That's important. And then start with as you work through the spiff model, to look at where's your community readiness. Are they ready to hear? Are they ready to understand? Are they ready to be motivated to take some actions? And just basically work through that whole system. And we'll be addressing that here at Prevention Action Alliance, and certainly at our statewide coalition meetings in the coming months. So stay tuned, and we'll all work together on it.
Thank you, Marcie, for that. And the same viewer had a follow-up, more of a comment than a question, but she did say that she wishes we could host an event that is targeted towards the 512 doctors who have that certification, to kind of help with messaging and maybe create a partnership. And I'm not sure when it comes to the logistics of that, what's possible and what's not, but that is an idea that you want to throw out there. So yeah. So it's a good idea. It's a good idea, and we can definitely take a look at that. So other than that, I'll wait a couple more minutes to see if any other questions roll in. So it looks like we do not have any more questions. So once again, I just want to thank everyone for attending this morning. I do understand the month of July is a weird month as a lot of people are on vacation. It's kind of our time to recuperate from the year. But I do appreciate you guys tuning in this morning to listen to what we had to say. And for those who asked questions, thank you for that as well. And we will see you guys next month. Thanks.